Hi, I'm Nathalie Bonafé, and I'm a hospice volunteer with Seasons in Connecticut. Thank you for having me. The way I see my role as a volunteer is I am this extra pair of eyes for the caregiving team. And generally, I'm called at patient sites at various times in their lives or end of life. One example is I was called one day to that lady who is, I was told, all I knew about her was like she was originally French-Canadian. When I arrived, she had been sleeping, and I tried to connect with her. I tried to connect with her by touching her cheek or speaking her name, kind of like seeing if she would, but she would not react at all. And what I thought of, knowing that she was French-Canadian, is like I switched to French. And I called her name, and I said a few reassuring words, and she opened her eyes. That was a very intense moment for me, knowing that she had been in that coma. What the magic of it is that her daughter arrived at that moment. And I was able to just be the catalyst and let the two of them connect for their last words as the lady passed away a few hours later. So that was really magical, and I think it was really useful to that lady and her daughter. The things that I can do as a volunteer is I can hold hands, I can smile. Most patients like to be smiled at. They like the kiss on the cheek. What I like to do is like make sure that the family, you know, is comfortable with the patient is comfortable with the family. I help them feel like they are involved, and that everybody is comfortable. I want to be that reassuring presence that it's going to be okay, and put them in charge, all of them, and that's what I do.